Every 40 seconds, someone in the U.S. suffers a stroke. Think about that. Every 40 seconds. May is National Stroke Awareness Month, so we want to make sure that you know all the warning signs of a stroke. We brought in News Channel 5 medical expert Dr. David Soria today to teach you how to spot the warning signs of a stroke. Hi, Dr. Soria.
How are you, John?
Good, good. So what are the obvious warning signs that someone is having a stroke?
Yeah, well, you know, a stroke involves the brain. And so what it is a clot in an area of the brain. So the symptoms could be diverse and very different. But the most important things to remember is a mnemonic. And I like to have our patients remember FAST. Yeah. And F is for, well, first of all, before we even get into that, really it typically involves the eyes, the speech, or weakness of the arms, okay?
All right.
So you really want to make sure that you kind of understand that it could be arm weakness, it could be slurred speech, visual changes, even dizziness.
Can't focus.
That's right. Any and all of those can do it.
Anybody susceptible?
You know what, the most common people that are susceptible are going to be those that have risk factors like hypertension, cholesterol, diabetes, those that smoke, people that are obese, and then of course if you have a family history. So you just need to be aware of your medical conditions if you're at higher risk, and then certainly have not only yourself but your family and loved ones around you be aware of those symptoms so that if in fact they do identify those, they know exactly what to do. And what is it that you do? Well, you call 911 because you want to get to an emergency room right away. Just like we've done a great job with chest pain. Everybody knows that if you have chest pain, might be having a heart attack, let me get into the ER, I need to be treated. Same thing goes for stroke. Time is brain. So probably the most important thing I want our viewers to understand is identify the symptoms, and if you have them, get to your nearest primary stroke center. You don't want any delays going anywhere else. Go to the closest facility that can treat your stroke.
All right, you mentioned a lot of factors. Age also?
Age is one. Obviously, the older you get, the more at risk you are for atherosclerosis. And then also even sex. Female patients have more strokes and die from stroke significantly more than men. So that's a lot. That's one thing that a lot of people don't realize.
You mentioned FAST. What is that? I don't want to leave that out. If that's
we have arm weakness. You have slurred speech, and then it's time to call 911.
All right.
Okay? All right.
That's good to know. All right. Lots of good tips there, Dr. Soria. Thank you so much for joining us today.